There's no proven treatment for the coronavirus, so medical care is supportive to give patients their best chance of fighting the disease. Most patients recover on their own without needing intensive care. To find out more about what these patients go through, I'm joined by Dr. Graeme MacLaren and Dr. Jyoti Somani. Dr. MacLaren is the director of the cardiothoracic ICU at the National University Heart Centre, Singapore, and Dr. Somani is a senior consultant at NUH's Division of Infectious Diseases. So based on yesterday's figures, there are 1,210 patients in hospital, 16 of whom are in the ICU. Dr. MacLaren, you specialize in ECMO treatment, a form of life support. What factors determine a patient being admitted to the ICU to be treated for COVID-19?
So intensive care units have two things that a normal ward doesn't. One is it has one nurse per patient. And the second thing it has is a much wider variety of monitoring and life support technology. So with COVID, we've learned that these patients can sometimes deteriorate quite quickly. And because of the infectious risk to the staff and everybody else around them, it's important to try and anticipate this need in advance. So we have generally been admitting patients to intensive care earlier than we would otherwise to prepare for any potential deterioration.
Well, let's bring Dr. Somani in on this conversation. I understand around 80% of COVID-19 patients don't need any treatment, but they are closely monitored for complications. So, Dr. Somani, what is the general mood among the patients as you make your rounds?
Well, to be honest, the mood has actually gotten much better. Back in February, there was a lot that was unknown and patients were very fearful. I think they had looked at what had gone on in Wuhan. And then in March, people were looking at Italy and the US and were quite fearful. But now, given how well we've done in Singapore and with the understanding that the majority of patients do well without any treatment and without having to go to the ICU, the mood has certainly relaxed a little bit more. So that's quite gratifying for us.
Dr. MacLaren, what have been the hardest or the most challenging aspects for you so far?
I think the dominant problem with this has been the fact that this virus is so contagious. And I don't think most doctors have lived through this level of disease before where there's so much concern about infection spreading to everybody around them. So I think the contagiousness is an issue. I mean, the first time you ever walk into an intensive care unit that you know is full of COVID patients, it doesn't matter how experienced you are, you notice the difference. The other thing about this disease is that it's obviously a new one. And whilst it shares a lot of similarities with other viruses, it has some nuances, it has some new things about it that we're still learning about. And keeping up with this avalanche of medical publications in this area, I think is keeping everybody very busy.
Right, of course. So my next question is for the both of you. Do you get to experience any high points? Is there a silver lining as you tackle the virus, as you meet some patients, some of whom are very, very ill? Dr. Somani, why don't you go first?
Well, definitely there are silver linings. We've had many patients who've gone to the ICU and been quite ill who have recovered, and that's always very it feels very good to see, and it's nice to see their families as well become a little happier when and relieved when their patients do well. I would say the other big silver lining that we've never had before, but because this is a pandemic, has been how the whole medical staff and the entire hospital has pulled together, and that includes all the way, from environmental services to security to the nursing, as well as allied health, all really pitching in and coming together to make sure our hospital is safe for our COVID patients, as well as our non-COVID patients, and also for all our healthcare workers. And that's really been very, very gratifying and happy to see that we can do that. I think it's just unprecedented that we've been able to pull everyone together and be prepared. So that's also the silver lining.
Well, Dr. MacLaren, how about you? How do you get through each day?
Well, there's so much to do, I don't really have a chance to reflect on it. If you're looking at silver linings, I think one about this particular virus is that it hasn't really affected children very much. There's lots of viruses that preferentially affect young children. Look at hand, foot, and mouth disease, for example. This one, on the other hand, seems to make patients who are elderly or who are male or who have vascular disease, they do much worse. But at least children, with very, very few exceptions, don't seem to be affected by this. And that is perhaps one silver lining.
Well, Dr. MacLaren, what is one other thing that we haven't talked about yet that you would like the public to know?
I think the important message here is that it's the virus, whilst it's been unprecedented, it's under control in Singapore, and the resources and the foresight to deal with it, and it will go away, or diminish to a thing which doesn't affect our daily lives to remotely this extent.
Well, Dr. Somani, then over to you again. What is the one message you'd like to share with our viewers?
I think that while we are well prepared now in Singapore and our hospitals are well prepared, I think we will see probably in the short term an increase in cases when the circuit breaker is eased up. But I just also want to let the public know that if you have other emergencies not related to COVID, it is quite safe to come to our hospitals now. We have triage in place. We know how to keep our patients safe, all of them, whether you have COVID or unrelated symptoms. So if you do have an emergency, such as stroke-like symptoms or a heart attack or things like that, we don't want people to be fearful to come to the hospital because we do have safety checks very much in place.
Well, thank you so much. I've been speaking to Dr. Graeme MacLaren and Dr. Jyoti Somani. Dr. MacLaren is the director of the Cardiothoracic ICU at the National University Heart Centre, Singapore. And Dr. Somani is a senior consultant at NUH's Division of Infectious Diseases. Thank you to the two of our guests for taking the time to speak with me and for your hard work as well.